China. Basically, it's coronavirus, and because it was 2019 that it started off, that they added the 19 to it, so it's coronavirus 19. It started off, and we all saw the numbers in China. It hit a lot of them, with thousands. And before we knew it, it started coming in drops. By the time it came to the US, in fact, if you look at the numbers in the last 1 month, we were seeing 10, 20, 200. And then it started, like, what you call, that's where the word viral comes from. When you say something, a video goes viral. This is exactly what it means. When you say something goes viral. Now we are talking about thousands. New York, we started talking about 16,000, 50,000, 78,000. Now we are talking about number of deaths. I have a situation where in my hospital right now, the hospitals in northern part of New Jersey, which, if you know the geography of New Jersey and New York, New Jersey is just the border state to New York. It's like Ogun State and Lagos. So you just cross the river and you are in New Jersey. So many people who live in New Jersey actually work in New York. So when something happens in New York, we know it's just a matter of time. It will hit New Jersey. So when we started seeing thousands and thousands in New York, we knew New Jersey was going to be hit. So now, in northern part of New Jersey, there's a lot of coronaviruses and lots of deaths. We're now talking about thousands, and the hospitals are packed. They are now sending them, they have to take to different hospitals. My hospital, we are in the southern part. We are not very much affected. But we are now having a situation where they have to move patients from the northern part of New Jersey and distribute them to us. So that's how we are getting them. Of course, we have our own patients who we also have to take care of. So every night you get like 5, 6, 7 patients transferred from other hospitals for us to take care of who are COVID-19 positive. So it's real. It's a real situation that we are dealing with. People are dying from it. I will also say people are also surviving. We are discharging patients and they go home. I was going to take a picture the other day of one of my colleagues who incidentally was affected. I mean, he's my colleague. We work together. He was affected by COVID. We think he got it from New York because he lives close to New York. But he has since recovered and is back to work. And so we joke about it. We tell him that he's a COVID-19 survivor. So it's a real problem. It's killing people, but people are also surviving from it. The mysteries around it is unfortunate. It's not a very mystical illness. It's a virus like any other virus. The only problem is that the infectivity of this one is very high. And if you go through all the preventive modes that have been described, you will find out that it can be curtailed. That's why the Nigerian situation, I'm happy that he reacted quickly. Nigeria reacted quickly. All the shutdown, the closed airports, make people sit at home, those things were important. Some of us, I don't know how many of you have read the history, but if you go to 1918, the Spanish flu, if you actually take the Spanish flu, take the caption from the newspapers in 1918 when they had the Spanish flu, take the captions and bring it to today. You would think you are reading the newspapers of today. The shutting down of mosques, shutting down of churches, They were the same things they used. Washing of hands, wearing of masks, everything. You see the picture, it's exactly the same thing. The only difference now is that at that time they didn't have aeroplanes. What they were talking about were ships. You know, so ship was what they were controlling, ship movement. It wasn't plane. So it's the same thing. It's a virus. It's not mystical. It has just done what viruses do. And what do viruses do? They go viral. And this one, unfortunately, I think the real problem was that if you remember in January, December, January, some of you, if you were, I follow social media a lot. We used to see all these videos from China of them wearing masks, of people caught beating from the street and making. We were all laughing because we never thought this was a real problem. We thought it was a joke. And I think we played with it, and that's how we got ourselves into this.
All right, sir. Okay, so now you have really just have confirmed to us that this is a real case. This is what is happening. It is real. So Nigerians can hold up to that it is real because you are in front line. So can you confirm to us that it is actually real?
Yes, actually, well, as real as last night, I admitted about 7 patients that were positive. One of them looked at me straight to my eyeball, and you know, they asked a difficult question and said, "Doctor, do you think I'm going to die?" That's a difficult question to answer. Because guess what? I have seen some die. I have seen some live.
Now, those who have lived, what were the things administered to them, and what is the probability of them getting it back? Because now this is going to be taking us to the conspiracy theories of these aspects too. That there is a vaccine being injected into people, which will be connected to the 5G. So as a doctor who is in the front line, let's know, are you injecting any vaccine into anybody which is connected
right now,
to 5G?
Started injecting vaccines. They are working very hard. I mean, for a disease of this magnitude, you know that the United States government is definitely going to, they are going to do pump a lot of money. Not just United States government. Do you know how much is costing Hollywood? You know how much is costing NBA? You know how much is costing NFA? All these associations, do you know how much is costing them every day for us to be shut down? So they're going to put a lot of money into a lot of research. And definitely, like any virus that has been, there will be a vaccine. There will be a vaccine. A vaccine will be developed. And the vaccine will be given out. We will use it. You know, we're going to use it. I don't know what modality they are going to use to administer the vaccine, but there will be a vaccine. Right? There will be a vaccine. And different companies are going to produce them. So all these theories about this whole thing about the virus is a way of getting us scared so that they can give us a vaccine, that they will put a chip under us. You only need to read 1918 news. And you will find out that we are only just living through another pandemic. And just like it happened before, it's happening again. All right? Viruses, we have contended with. Every year we have the American flu, the influenza, which we have every year. We contend with it. But the only difference is this one, and I have to be honest with you. Personally, I have dealt with many medical conditions. But this particular virus, the symptoms and the way it presents, is quite unusual sometimes. Right? So I will need to send a note of warning to many of our doctors out there who are reading all the books. Listen, from somebody who is working in the front line, this virus has some very atypical presentation. I mean, I saw a patient, I was talking to one of my fellow doctors yesterday, we were talking about, she said, you know the funny thing about this illness, there are some people you see, they have the symptoms, And you are almost sure as a doctor, this must be coronavirus. And guess what? You send the sample, it comes back negative. Meanwhile, there is another one that came in. You look at the symptoms, they are all over the place, they don't look very typical. And guess what? You say, you know what, this patient, I just feel like keeping this patient overnight. You send the sample, it comes back the next day, patient is possible. So there's a lot of studies that still needs to be done. I have to just admit that. A lot of studies have to be done on this virus. Vaccines are going to come out. The vaccines are going to be effective. And the moment we get a vaccine, coronavirus will become like any other viruses in history. And that's all I have to say.
Okay, now let me go to some of us who are end users, and I will start with Reverend Chucx, who is a user of networks and some of these devices. Now, are you also looking at 5G? Now, I know that you may be talking from the advantage part of it, but from all what you've heard and from what you've read, what has been your points on this issue of 5G and COVID-19?
Thank you very much. I would like to say that, like every other device, there are bound to be pros and cons, advantages and disadvantages. And this is what the specialists used in creating guidelines to say for this device, like the microwave oven, like our bishop has said, and the prof, you need to cover the doors of the microwave oven in order not to be exposed to the radiations. So the guidelines are always there. We all need to be kind enough to say there are side effects, but they are not as bad as they are being projected. Somebody must have misinterpreted the information when they said 5G is going to be 10 times more powerful than we know. When they were talking of power, they were actually referring to speed. They were not talking of power in the sense of heat, right, or in the sense of damage. It was the power in the sense of download speed. Some people, 5G that was tested in South Africa had the capacity of about 750 Mbps. And when it is stable and it is consistently effective, we should expect as far as 10 gigabits per second. That was the report given in 2017 at the ITU, the body that manages technology and all these things globally. So we have to, on our own, be sure that we follow these strict guidelines. Like I can say again, the 5G, whatever effects that we are scared of in 5G is not as bad as the 2G and 3G that we have always been exposed to. And that's the misinformation that people are having. So unfortunately, we are sharing videos around. For instance, I saw the video from the Medical Association in Canada. That video was shot in 2019, July. And that video was presented to the government, and the government listened to them and reviewed the issue, called the doctors along and said, okay, let us recheck to be sure that what we are doing would not harm people. And in the process, the doctors realized that what the government was doing was safe. It was after this understanding that Canada went back to the drawing board and went ahead to approve it. Now, 5G may not have been deployed in Canada as much as it has been deployed in America or in South Korea. This delay was caused by that video. But the mischief that we are noticing now is that a video that was shot last year is being shared in 2020 to say that people are still rejecting it today, which is not true.
Okay, so now let me go to the Canadian who is there, who can also expatiate on this. Mr. Olaolu, you are a communication specialist, and I'm sure that you have been following this trend. And do you think there is an intent behind moving from 4G to 5G? And with the connotation of there will be a vaccine to cure COVID-19.
Hello?
Yeah. Can you hear me?
Okay, I didn't get the last part of your question.
Yes. Do you think there is something behind the launch of 5G last year and the sudden outburst of COVID-19 in November?
Okay. Thank you very much for having me here, and I greet the viewers and the panelists. I greet everybody. First of all, what I'd just like to say is this. When any new technology comes, there's always conspiracy around it. It's unfortunate that the conspiracy that has to do with the 5G came at a time that was in consonance with the outbreak of COVID-19. So you'd always find out that that way to find a cause would always create conspiracy. That's the way the mind of man is wired. Our minds are always wired to want to dig into facts and add 1 and 2 to see what might be the root cause. Unfortunately, most of the time, we're in a world where bad news spreads. Like someone said, if it leads, it bleeds. So that news has to be bad, has to be a very strong conspiracy for it to bleed. And what we're seeing today is conspiracy taking the edge. Now, conspiracy is going to take the edge, as it were, because there's no cure at the moment to COVID-19. So if COVID-19 already had a vaccine, then the conspiracy of the 5G technology would have been put to bed. But in a situation where you don't have a vaccine and you can see the toll on death rise day in, day out, you can see like America now saying the peak for New York for the number of expected deaths is going to be April 16th. There's naturally going to be agitation. And you can see what is happening globally. There's confusion, there's panic, there's anarchy, because this kind of situation last happened over 100 years ago. So in our living life, we've never felt or seen anything as bad as this. The worst that we've ever, I think, might have had that created a scare must have been Ebola, even though you have other diseases that has higher death rates, even malaria. But you know, when Ebola came, it created the kind of scare we have now. Unfortunately, this is at a global stage. So the 5G network itself, by my own personal opinion, and without thinking too far, has nothing to do with the COVID-19 virus. Otherwise, people in villages or people in Osun State where you don't have 5G shouldn't be dying of COVID-19, shouldn't even be infected by COVID-19. So sometimes it's laughable when you see, educated people who are also carrying these misinformations. I try not to blame people for that, because we always have to find, by human nature, a cause to every issue. So for me, the two are mutually inexclusive. They have nothing to, they are mutually independent of each other, sorry. They have nothing to do with each other. They are independent of each other. In terms of the kind of effects you have with technology, I would say this, that 5G has its cons, just as driving your car has its cons. We've always known technology and science to create some sort of, health hazards and issues in society. We have global warming, which has nothing to do with 5G. And I think part of the fear with 5G is because to create that millimeter sort of frequency, you bring in receptors to very close to human level. And so that means that you have very fast, very high frequency and the likes. Those kind of create the fear that the contact level is much. But from most of what people are saying, even from what some of the panelists have said, we can see that in the real sense of it, it necessarily does not in itself pose any immediate danger to man. What I think at the end of the day is the danger to man, if we're going to use technology in itself, is the aggregation or the integration of all available technologies we have working at the same time. Then you have threats to man. You have threats to the potential health hazards increase. Because when you have factories that are creating high level of combustion. You have technology that is emitting some level of radiation, howbeit low. You know, you have so many technological factors working at the same time. Then the integration can, you know, have some level of health hazards. For example, in China, during the COVID-19, a study was carried out, and they found that the oxygen levels in China actually improved. But before the COVID-19, when all the factories were working full blast, China was one of the highest polluted countries in the world, because the factories were blasting full blown, and this also, you know, has its health hazards to come to play. So it's not the 5G in itself, and definitely 5G is not COVID-19. But then when we look at technology in its own brackets, then we can talk about the possible risks and hazards that technology has to pose. That in itself is not excluding the benefits of technology, because the benefits of 5G to us as a people is amazing. The benefits of 5G to the government is amazing. Like someone said, the government even benefits more, because now, if you look at China, it's on record that China was able to contain COVID-19 using the same technology we're complaining about, because they use artificial learning and artificial intelligence and machine learning to manage the spread of COVID-19. So when you get into China today, your social network and everything is connected. Before you even leave your house, you need to like have your iris scan done. And as you're having the iris scan done, it automatically takes your body temperature. That is fed into a data warehouse, and that data warehouse automatically checks your temperature and gives you a color code. The color code is either green, yellow, or red. So we can't, and once it's red, it creates an amber instruction to the government, and then they can track and know places at risk or people at risk. So China has used technology to its advantage. I don't see why other countries should shy away from using it. The word, as it were, should be how, as much as possible, we mitigate the effects of technology, as it were, in respect to health hazards. But 5G in itself, I don't think it's so much of a health hazard to us.
Let me come in there. And okay, maybe unfortunately we have three pastors. Mr. Olaolu is not an ordained pastor. So now we will get to the level whereby Bibles has to be on a 5G network to be quoted very fast. And but let me go back to Prof, sir. Now, a lot of people have felt that the high frequency to be utilized by 5G, which will now bring base stations closer to people, and those are part of the theories that are flying around, that the closer these base stations, then the more effect it has on human beings. How can you help us clear that out, sir?
Okay, thank you. Let me give you this analogy to explain that. You have two sprinters. One is very tall and the other is very short. The one that is very tall, whenever it takes a stride, his stride would cover a sizable distance, while the short would have a small or shorter stride. Now, if the two of them if you ask the two of them to, you know, run some distance, now the guy that is much taller would cover more distance with few steps. Okay, it will cover more distances, and the guy with the shorter guy will cover smaller distance, and yet it will be very tired because we will spend a lot of energy, and then it will be very tired easily because its stride is very, very small and it can't cover so much. Now that is what happens. The 2G, the 3G we have been using, the wavelength at which they operate is much higher than this millimeter wave bandwidth, the region that the 5G will be operating. Now, at that region where 5G is operating, the signal dies off easily. Let me put it that way, because like I said, the millimeter wavelength, so it's not going to travel too far before losing, the allowable level of signal level that we make your devices to interact with it. So this now would make this now makes that infrastructure demand for 5G is much more than other ones. So we are going to have base stations, base stations and switching stations very much closer than what we have currently. So I'm going to have them because the signals cannot travel much. Just like you see, a wall would block the transmission of your infrared from the remote. Okay, your remote cannot operate beyond, cannot penetrate a wall. Okay, the infrared from the remote cannot penetrate a wall. So the same way, this millimeter wave will not be able to penetrate some disturbances or obstructions on the way. So that's why there is need for a clustered base stations. Cluster base stations, which is more or less like a departure from what we have before. So that's the situation. So 5G is going to demand more infrastructure. So we're going to have more base stations around us. But that does not really say that they all be the hazard will be that much, because the level of penetration of the signal, just like my previous analogy of a short runner, okay, it's going to die fast. It's going to be tired easily, things like that. So I think that explains it.
Okay. Now let me go to Bishop, Doctor. Now you've heard that. Let me ask you that from your medical experience or your researches, have you found out if there are any confirmed research about effects of some of these radio frequencies causing illness?
Well, what I have seen, at least for the 5G, I've looked at there's a lot of conspiracies out there, all over the place. But if you go back let's go back to the ones technologies we've used before now. There were stories about people using cell phones, and sometimes people say, don't put your cell phone in your chest because it can cause rays to go into your body, and it will cause tumor in your body. Some people say it will cause a tumor in your brain, your head, and all that. So it's a lot of theories out there. But and then some people will tell you that when you use internet a lot, you start having headache. That is the rays that go into your brain and start making you to cause headache. If you want to know how much the rays is causing headache for you, what I'll tell you is to take a long sleep. Most times, it's not a lot of the direct effects we have, many of them are not direct effects. They are due to utilization. Right? Like he just explained, the professor explained, many of these rays and that we are talking about, the level, if you look at the level that they are not. If you look at look at CT scans that we use, for example, that we use all the time. If they tell you how much of rays are generated by the CT scans, the X-rays, nobody will want to use them at all, right? Nobody will want to use them. So the reality of it is there is no way any form of irradiation will not have some level of effect on cells. But the question is, how much of effect does it have? Significantly, not much. And it cannot be compared to the use that is going to. So a lot of times, you're going to have to, like everything, there's nothing like absolutely 0%. There will be nothing like 0%. But when you put the effects, like everything in medicine or anything, you look at the pros and the cons. You can decide whether you want to. My wife, for example, my wife doesn't have a Facebook account. She used to have one. Now, she chose not to have a Facebook account. I can't live without a Facebook account. I mean, there's no way. I can tell you straight, if I want to make a confession, I'm an addict of social media. So there's no way I can possibly do without a Facebook account. So if you like, you go find all the theories in the world and say if the Antichrist is going to come through Facebook, then I will tell you I already have 66. The number is already complete. So just try to make a joke of this. But you see, the thing about it is, what I found out is that many, like somebody said, every new technology that comes always comes with fear. And like he said, this one came with this viral illness, and then now we want to try to tie it together. And that's what's really happening. If you go through, the literatures I've said, I haven't seen anything that is convincing. So I've not seen anything. I can't wait for the 5G to be launched. I want it, because if you look at it, I'm downloading something and it's taking me. The other day I had to upload a video to Advent Cable. And I know how difficult it was for me to upload it. A simple, small 5-minute video. It takes you a long time. The 5G is going to make you upload it so fast. So here's where the problem is utilization. Because when you start using the 5G, you see, if I upload a video and change my mind, I could be uploading a video and 5 minutes into uploading, I say, you know what? This video I don't want to upload today. I change my mind. The 5G, you are not going to have that. The video would have gone before you change your mind. All right? So that's where the problem is going to be. The video would have gone before you change your mind. You know, so that's where the caution is going to be. If you think that you send pictures, you know, WhatsApp, for example, when you send some pictures, you say, oh, then you quickly delete it. You made a mistake, you delete it. When the 5G starts, there will be no mistakes. If you send the video, it's already gone. One chip, one click, it's gone. So I don't medically, absolutely no.
Okay.
Anything you see out there is all theories and theories. They are not proven.
Okay, now, Reverend Chucx, let me find out from you what you make of what Pastor Chris Oyakilome put up a bit last week that was trending.
There are quite a lot of things he said. I don't know. Can you be specific? Which area?
No, especially. Let me be specific, because that has created more videos that you are seeing. Now, when anybody see during the lockdown, when you see fiber optic school being laid, it is now 5G being deployed, and you know the pastors made mention of it.
Okay, let me see if I can highlight 4 points in the video. he mentioned the issue of fear. He mentioned the issue of the Antichrist. He mentioned the issue of the federal government. And he mentioned the issue of the fact that the virus is not the one killing people.
Okay.
Now, I'll start from that last one. I decided to talk about it, not because I have... Pastor Chris is a very close friend of mine. We'll remain friends. As in, he's somebody I respect. We'll remain friends. But to say that the virus is not the one killing people, it is a misleading information, and it can put many people's lives in danger because they listen to you, and that could cause them to expose themselves. So that is why I took it upon myself to talk about it, that it is wrong to say that it is not the virus that is killing people. That is wrong. And we have disproven that in this conversation. Now, the second part is when we say that the federal government is busy laying up 5G, and that is the reason why there is a lockdown. That also is not true. There was a test of 5G sometime late last year by MTN, and the test was successfully carried out and it was shut down. There is a lot of process that goes through under the federal government with the rules and regulation that guides the frequency allocation agency. There's an agency that does it. They don't just wake up and federal government is laying up 5G. No, federal government is not a telecoms provider. They will issue the license for each frequency to avoid interference. So if there has not been a bidding, there has not been auctioning, there has not been sales, there has not been purchase, you will not see 5G anywhere. So those information were also wrong to say that they are laying 5G. Fiber optics has been with us for more than 10 years. If you go to Ogumosho, if you go to Ikire, there are fiber optic cables being laid down everywhere. We have hubs in Lagos, like for my office. There are times when there will be a fiber optic cable cut, like in Antony, and there will be a loss of contact between my office in Unuigbe and my office in Ikeja. So when that happens, we call the operators and instantly they rush to go and repair the cables. So there's always, almost on a daily basis, a replacement of fiber optic cables. If fiber optic they will not be digging the ground because 5G is not something they put underground. It's something that has to be on the surface. And the part where we say it is leading to the Antichrist, I need to point clearly that we are actually at the end times. The end times we are in is the fact that some people might not make it out of this COVID-19 pandemic. That is the end time for them, because in the book of Hebrews, the Bible says it's appointed unto man once to die, and after death comes judgment. It's the end time for that person. But we are focusing too much on the random signs. You are seeing end time already. You are seeing people dying. Instead of you taking Christ to those people who are dying, like the thief on the cross, we are busy looking for the signs. We are quarreling over the signs. It is a big distraction. And this is responding to somebody who asked on Facebook that what is the intent? This is a distraction, I must say. Okay.
Now, Bro Olaolu, just because we are trying to get more into the issue of Antichrist, but can you also make comments on that Pastor Yakilome?
I think it's unfortunate that the church that is supposed to be the arrowhead for leading people in the right direction sometimes tend to politicize such conspiracy theories. The question I would like to ask is, which is more important? For me to know that it's a conspiracy theory or for me to be healthy? So, for example, we've had time immemorial that HIV is a conspiracy theory from the West. We've also heard that there are vaccines for things like malaria that can cure malaria forever. But because some pharmaceutical companies want to make money, they won't release the vaccines, or there are vaccines for cancer, or cancer is man-made and we could solve it. So the question is this, because sometimes it's very good to apply logical sense. If indeed it was even a conspiracy theory to, make money, shouldn't you keep yourself safe? So if you should keep yourself safe, where is the logic in trying to find out what is a government trying to make money or not? The governments of the world generally have been created to make money. They've been created to build the wealth of the world. So why is the church so bothered about the wealth of the world than the wealth of heaven? If the church is more interested in salvation and the wealth of heaven, let's get ourselves off the conspiracy theory of what the world is trying to do. As a matter of fact, even if it were true, which to me it's laughable, that there is a huge conspiracy on 5G. What can someone like me do? How can I stop it?
It's not.
Have we been able to stop the fighting of Boko Haram or ISIS? Or have we been able to stop what is happening in different parts of the world? What do you want to do about the conspiracy of 5G? If the federal government of Nigeria is going to lay 5G tomorrow, there's nothing anybody can do. I remember that the federal government wanted to bring in Chinese doctors, and there was a lot of outcry. The people screamed on social media. We even had the Medical Association write and say we're capable. But when the federal government was resolute about it, there was nothing anybody could do. So the best you could do is to keep yourself safe. It's a man who is not dead. It's theories. And unfortunately, it's this kind of theories that make people not see the danger and the harm that has to do with social distancing. I've gone on my social media pages so many times, and all I keep telling people is, you know what, just keep yourself safe. If we're not safe, like the doctor on the program today is talking about, and he's seeing people dying. Those dying people would regret the fact they couldn't keep themselves safe. Somebody asked him a question, am I going to live through this? The guy is not concerned about the conspiracy theory of Internet of Things or whatever. What the guy is just concerned about is, am I going to live? If that guy, God gives him the opportunity to live, trust me, he's not going to quarantine for 14 days. He's going to quarantine till he hears that coronavirus is gone. So it's unfortunate that the church that's supposed to be the education center is politicizing issues. Not just the church, even we have so many religious organizations, you know, with a lot of funny theories. I don't know how true it is, so I don't want to say it as a matter of fact, of a statement in Nigeria that is saying going forward, they would allow for Jumat services on Fridays because they found out that they are going to create preventive measures to ensure people don't have the virus. And it's unfortunate that for a country where we have over 200 million people and we have tests per 1 million population of between 24 to 200 people, and so far it is believed that Nigeria has just tested about 5,000 people, the government is just reacting and we're not even thinking. You have a country like Vietnam of 95,000 people, and they've carried 95 million people, and they've carried out about over 100,000 tests. They have 95 million people. We have over 200 million people. We've done about 5,000 tests. Vietnam has done over 100,000 tests. So what is the priority for our leaders, both spiritual and political? Is it telling people who we don't even have the data? We don't have the right data. So which is more important, telling us about what the government wants to do or telling us to protect ourselves? I mean, even when in the Bible, when Jesus, you know, healed the lepers, the first thing he said to them was, go present yourself to the priests. Because for everything, there's always a process. There's always a procedure. You know, talking about the Antichrist and all those things is also laughable. Because at every stage of an advancement, we've always purported that it was the Antichrist coming.
Okay, now let me cut it
Yes.
and take this short break, and we'll be right back just to now go into the issue of Antichrist. To some extent, we've been able to deal with the issue of COVID-19 and 5G. Now, linking it to Antichrist and the frequency of and the expectation of Antichrist is what we are going to be taking after this. And the phone lines are open for whoever wants to call in. We've seen some questions on Facebook, which we're also going to be dealing with. But after the break, you'll be able to speak and make your contribution too. Stay tuned.
God created man, his greatest asset in his image, and handed over the entire world to him. As the journey progresses, man finds himself in a challenging time as he battles with the coronavirus. The Diocese of Lagos Anglican Communion enjoins all Nigerians, especially Lagosians, to cooperate with the government and relevant agencies as we work together to defeat this epidemic. Stand strong, but staying at home is key to help stop the spread. If you feel unwell, call NCDC's 24/7 toll-free number. Do not panic, because there is no fear in faith. Keep trusting God and keep praying. This too will pass away, and the peace of God, which surpasses all understanding, will guard your hearts and minds through Christ Jesus. This message is brought to you by the Right Reverend Dr. Humphrey Bamishebi Olumakaye on behalf of the Anglican Diocese of Lagos.
All right, it's exclusive on ACNNTV, and we are talking about 5G, COVID-19, and Antichrist. We've been getting facts from experts and Bible scholars who have looked at all these conspiracies and informations that are out there and trying to tell us the real thing that is out there. Now, let me go back to Prof. Now, Prof, we are not going to be more talking about Bible, and thank God you are a professor and a pastor. So there may be a way of trying to balance up this. Now, the issue of Antichrist. In fact, one of the audios has claimed that you can sin between now and 2022, and your sins can be forgiven if you ask for forgiveness. But after 2022, when possibly 5G has been rolled out, your sins will no longer be forgiven. I mean, these are part of what is out there. So, what can you say to this issue of Antichrist and 5G? Then some people have said that Bill Gates said there will be some vaccines that will be installed in human beings. These are various things. If I begin to count various write-ups and videos that are out there, which I'm sure possibly you have seen some too, what are your immediate reactions?
Say that it is scriptural to say people should continue to sin. The Bible says, shall we continue to sin and say that grace will abound? God forbid. Now, the fact is, it is wrong for a child of God to sin. And then, if a righteous man should die in his sins, at the end, he's going to hell. The kingdom of God, the kingdom of heaven, is meant for those who are accepted Jesus into their life as their Lord and Savior, and who are living right. So the right thing for a believer to do is to live right and expectant of the second coming of Jesus. So that's a fact. Then the other thing about 5G, Antichrist, and things like that, well, I haven't explained some few things in the past. I just want to say that the fact is, the technological development now is going to provide some platforms for the Antichrist to operate. No doubt about that. It's not really 5G. We have Internet of Things around us now, and then where you can actually trace whatever, with an IP address, and then you can actually communicate, remotely. That is IoT. We have the RFID also, that you can put just a small, RFID, device on anything, even on books. You can't take some books out of the library, with those things there. And then we have, the fact is this, all these technologies that we have developed or that are involving the internet, IoT, AI, and then machine learning, and then the RFID things I've talked about. Eventually, 5G is going to provide a form of convergence. There'll be some form of convergence because 5G provides bandwidth, large bandwidth, that it's going to make some of these things to, interconnect and then communicate or interoperate very, very easily. So no doubt about it that 5G is going to provide some platform, for integration of technologies, and then governance, and then so many things like that, even world economy and things like that. But you see, I see no reason why a child of God should be bothered about these things, because as it were, you're not going to be heir. If you are born again living right, you're not going to be heir when all those things will be enforced, and then you have to. And then, of course, the truth is also that implants, that have been developed here and there, to solve different problems under what we call the human-computer interaction, HCI, and then so many things that are being developed also for health, for well-being, wearable devices and things like that, and then integrating all this. Of course, 4G is already providing some form of integration, but you see, 5G will bring some convergence and then provide bandwidth at which it's going to operate very fast, like Bishop said earlier on, that before you blink your eyes, these things are already communicating, they're already connecting and things like that. So that's going to make, provide some platform for the Antichrist to operate, no doubt about that. But you see, that's not a bother as a child of God. Live right, live with the expectation of the second coming of Christ. And then you see, some of us are actually in the research, and then we are also making our contributions to this. So we live here, we occupy air, and then when it comes, we go as well. Okay, so it's not really a bother that Antichrist is coming, but Antichrist is not going to dominate over the children of God. If someone reads the scriptures very well, I know a lot of eschatology teachings are going on around now. It's not going to. It's only those who miss the rapture that will be all subjected to some of those things. So there is no fear that a Christian should have as touching that. And let me just say this about electromagnetic spectrum. Someone saying that fiber optics is going to be, electromagnetic waves can be communicated, can be transmitted through diverse means. We have the cable, we can use cables, we can use waveguides, we can use radio link itself, we can use optical fiber. And then this optical fiber provides a backbone for the structure. So you see, 5G does not, you don't need to install optical fiber around town for 5G to operate, but it's just like a backbone, the same way it's like a backbone or a fallback for 3G and 4G, and that's the same thing. And you see, it's just unfortunate the way Christians have seen us. We should not fear. This should just prepare us for the second coming of Jesus. Of course, all these technologies, all these evolving technologies would help, the administration of the Antichrist at the right time. But you see, we should live and maximize our living while we are still here. Thank you.
Okay, thank you. Let me ask Mr. Orakume Lucky, and he's asking that there's a vaccine being pushed by Bill Gates, which is going to have as an implant chips on it. And if that's why is the vaccine not going to be a liquid vaccine? Why is it going to be chips?
Is it
Hello,
that question meant for me?
No, for doctor, for Bishop, sir.
Okay, thank you. Yeah.
Okay, well, I have not. I'm yet to find out about how that is going to happen. But even if that is going to happen, those of you who have followed the trend with Bill Gates, Bill Gates is one who is a man. You look at him. Bill Gates, all he has. Bill Gates is not mystical. Bill Gates is just intelligent. Okay, he's just intelligent. Bill Gates is a man who sees a problem that people are. He goes miles ahead of what people are thinking. You know, it's at the time he started this idea of having a computer. You know, those of you who saw the trend of computer. When I was in Unuigbe, the only computer they had was locked in one big room. One room, it was one room. They locked it with iron gates. You know, to get into that place, it was lock and key. One, that was when they were COBOL and Fortran and all those crazy programs. So what did they do? They reduced everything. So what this man simply does is make things easy, right? If they are going to end up with a vaccine that, you know, I don't know how that is going to happen, but I'm going to do it. For living in America and living in a developed world, I can tell you what you are scared of, it's already in you. Okay? What you are scared of, believe me when I tell you, what you are scared of is already in you. Guess what? This one, see this is your finger. How do you get on your laptop now? You just put your finger, right? And then it scans your finger. And you go into your computer.
Bishop,
right?
Can we take this caller? Can we take this caller briefly before you continue? Can we just take this caller before you continue? Yes, sir.
Sure.
Hello.
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 Yeah.
Yeah.
Go ahead with your contribution.
Yes, my contribution is this. I actually did not follow your program from the beginning. Now I just turned it on, saw your program. But I followed Pastor Chris' program from the beginning. I think that's what is the problem in with so many of us. We actually did not follow the program from the beginning, and we make criticisms that are not right. Please, I want to suggest, I followed him from the beginning, and I want to share with you what he meant. He is not preaching against it. He's not preaching against you not becoming a Christian or becoming a believer. He also preach for us to embrace Christ. At the end of every office is closure for the day. You will hear him call an altar call. But one of the things that he pointed out is that he wants to make us understand that the Antichrist is moving above his time, and that we should pray before that happens. He also makes us understand that rapture will take place even before those events will take place. Are you all getting what I'm saying? He also made mention of that. Second thing again, he made mention. He made us to understand what is going on in the world. Most of us don't make research. And then we sit down somewhere and we begin to speak against the man, insult the man. And this is coming from the body of Christ. And this is wrong. The third thing he made mention again that he made us to understand. He made us to understand that the vaccine that we get is propagating around the world today has the power to make you not to know God at that day. So information must be left for those who are going to stay behind. And information must be left for those who are going to stay behind. Even when we are going to go, some will remain, but they should be guided rightly.
Hello, sir. Hello, sir. Can I come in here?
And this is viewed all over the world, nearly all over the world. 3 billion persons view that. If God was not involved in it, would 300 billion persons connect to this? It has never happened before. It has never happened before. Let us not criticize the man. But let us follow what God is saying. He's a man who makes research. He makes research both in the Bible and both outside. I value the man. He has given us information. Look at what he has done now, has made the church to go back to the message, to the original message. What is the message of the church now before? Prosperity and all that. I preach it, but then that's not the message of the church. The message of the church is rapture. Prepare the people to go to heaven. That's what Pastor Chris is presenting to us. That's what this broadcast has brought us.
Okay.
And now many churches have gotten back their messages.
Okay, you've made your point there, and so let me take Bishop to first of all react before I take Reverend Chucx on that. So Bishop,
okay,
go ahead, sir.
What I can tell you is that from generation to generation, we have always had people who come very convincingly. And by the time they present these things, I mean, those days when we were young, growing up, I remember the people who came to my village, the man who died and rose up and came back rose from the dead. One Augustine, which I don't doubt that he did. But a lot of people gave their life to Christ then because of fear. The way he presented the gospel that day, you think the world was going to end that week. Many of the people who gave their life, if you don't give your life to Christ out of fear, you see, first of all, we talked about this Antichrist, this millennium and all these things, and we said all this the virus thing is to make people afraid. My question is, the message of this, all this message we are now spreading now, is it really a message of love or of fear? The truth of the Bible is all instilling fear in people. And people are watching them, but prayer, to be honest with you, my real prayer, my prayer is that people didn't believe. I'm hoping that people didn't believe what they were hearing. I am praying seriously that people didn't believe, because you know what? As I'm talking to you, there is a who has just been taken out of vent. He was on vent for almost 2 weeks. All right? We were praying for this man to live. We're talking about, I just saw a woman, I admitted a bishop last night. This bishop has lost 3 of her bishop friends. She sent a message to me while I was in the hospital. She said to me, Dr. Unuigbe, are you in the hospital? I said yes. She said, I'm feeling some symptoms. I have my son. My son had COVID-19. I was exposed. Do you think I should come to the hospital? I said, come to the hospital as fast as possible. She came, and guess what? We did our x-rays, and they didn't look good. We admitted her immediately. We have started her on the controversial medication, hydroxychloroquine, and other things that we used to treat them. But she came on time. And she looked at me and said, do you know what? I've lost 3 of my bishop friends to this COVID-19. The reality of it is, I just can't imagine that anybody would believe that this whole thing is a conspiracy, that people are dying from a viral illness. We have now thrown. I'm just praying that nobody will act on those information. I just hope that people don't believe it. At least they don't believe it to the point of going to. You don't want to test this virus. This is my warning. You don't want to test this virus because you will not live to tell the story. All right, you will not live to tell the story. So let's just leave it like that. The issue about Pastor Chris and I think Pastor Chris is somebody we all respect, and that is why this is particularly worrying now. A lot of people listen to him. right? I think, honestly, the reality of it is, I don't know where he got his information. I think he got some information, but I think the information may not be completely correct. All right? Some years ago, I don't know how many of you know that. I mean, today, Deeper Life uses all form of technology. I grew up in an age where Deeper Life don't watch television. Right? Deeper Life didn't watch television. So what then happened? How do you now go back to the people who threw away their television because we said the television was the devil's box? All right? That was the devil's box. But are we saying that, how did the devil now, who cleansed the box? And who got the devil out of the box? So what we are dealing with now is nothing new. When I see people jump over their cliff, there is nothing new. All right? This is not the first time we're having conspiracies and controversies. There's nothing new. If you remember the year 2000, 1999, how many of you remember? If you remember 1999, before we got to December 1999, people said the computer is going to suddenly go blank because we are going to have 00. We have 00. Right? So it's going to go blank. And I remember I know where 1999 going into the year 2000. I was looking at the computer to see what's going to happen. I was one of the few people who have a computer. I was waiting for my computer to go blank because they said so. It didn't go blank because I remember people were having backup, do all kinds of things because they said the computer was going to go blank. All kinds of conspiracies. Did the computer go blank? Computer didn't go blank. So what I'm telling you is, I am bold to tell you, take it from me and take it and cash it. Pastor Chris is going to use 5G. Okay?
Sure.
He is going to use 5G. All right? So I'm waiting for that time when they start using 5G for their ministry, and I will remind them that, was it not the 5G we said was being propounded by the Antichrist? You know, sometimes it's very, we have to be careful how we confidently propagate things that are controversies. Because over time, when you find out that you are wrong, I hope you will be humble enough to come back and say, guys, you know what? I got that one wrong this time, you know.
Okay, thank you very much. I hope you can hear me. Okay. In response to what the gentleman said just now, there was an interview recently by Trevor Noah, the host of the comedy show on Comedy Central. Trevor Noah called on Bill Gates. I don't know if you can see it. And that interview was about 6 days ago. Now, Trevor Noah in that interview spoke with Bill Gates because people have been rumoring that Bill Gates is like on the forefront of this vaccine production and all the conspiracy. And Bill Gates was very clear on it that the role he is playing is to encourage governments and nations on their fight against viruses and sicknesses and diseases, and this is a continued effort. Majority of his support and role he's playing in this regard is to encourage them on research, and those research are encouraged by funding to do the research. Bill Gates did at any point in time say he is going into. Now after that, he has been, even Trevor Noah, who was in the interview, has been given life threats by many people, and some people who read the information. And in response to that, this is what Bill Gates said. He said, "We are glad that Africa is fighting coronavirus, and we are also happy for Ramaphosa, the president of South Africa, and is also the head of African Union." So he said he is impressed by the work they are doing. He never at any point in time said they are producing any vaccine. So it's amazing how people came up with that strategy everywhere that is producing a vaccine. These are all rumors, these are all top information. If Bill Gates is making a vaccine, he will not hear anybody to mention. That is what he's doing. He's only financing research. So if there are money that have been provided for doctors and researchers and biotechnologists to go into research and find a cure, he's willing to drop money. But it is unfair to him, after all the kindness he's showing in this report, to cook up stories in order to blackmail him with the conspiracy theory that he's trying to cook off a vaccine for more. He has better things to do.
Yeah, I don't know if I could add one or two things to that. Yeah. Okay. So this is my position to it. Matthew chapter 24 tells us, if you read from verse 26, it says, "So if anyone tells you, there he is out in the desert, do not go out. Or here he is in the inner rooms, do not believe. For as lightning that comes from the east is visible, even in the west, so will the coming of the..." The truth of the matter is that the Antichrist, the coming of Christ is not known by anybody. And he said that it's going to come as a thief in the night. And it's definitely going to come. It's going to come like lightning. So there's no need for us to start calculating the coming of Christ for Christ. Because when he's going to come, nobody will know. Unfortunately, the Antichrist has been with us since forever. As a matter of fact, my own position, my own belief is that whilst a lot of us look at the Antichrist as one man, today, social media has proven that there are a lot of Antichrists on even social media already without knowing. There are a lot of people who are speaking against Christ and the body of Christ, even on Facebook, on Twitter, on Instagram, on LinkedIn. And anything that is Antichrist is anything that doesn't favor Christ and the kingdom of Christ. And we have these people come, condemn the church, condemn Christ, even believers who used to go to church before. They are no longer going again. And if you read Matthew chapter 24, it's very clear that when that time is going to come, the love of many will wax cold. Believers would lose their faith. We're looking for the Antichrist and we're looking for a calculative sign. But every day I look at it, I see the Antichrist on social media without even knowing. Some of us believe that the Antichrist is going to be a political leader. Who told you the Antichrist is not one of us? So whilst we spend so much time trying to calculate, why don't we work our salvation with fear and trembling? And so we talk about the implant from Bill Gates, and immediately we term it part of the signs of the Antichrist, and I laugh in my mind. Because if you're in the West, you will know you don't even need an implant for your information and your data to be in the open. You don't need it. Your data has been open right from the day you had the social security number. As I'm speaking right here now, there is somebody somewhere that can track everything I'm saying. Even Facebook now tracks what you write. As I'm writing something as big as Facebook is bigger than the population of Africa. It's a continent on its own. And Facebook can track everybody's comments. You have apps today that can track your movement. Apps ask you for your location. There's some places you call. And when you call, all they just ask you to mention is your name. And when you mention your name, they immediately and automatically know who you are. So the point is this. Let us not spend so much time trying to do the calculations of the Antichrist. Because the Bible has told us that the Son of Man will come as a thief in the night. So our calculation is not heaven's calculation. It's like we're trying to help God to calculate when he's going to come. That's not going to happen. It's like the Bible says in verse 27 of chapter 24 of Matthew, for as lightning the Son of Man comes. When he comes, nobody will see it. Nobody will expect it. Like Reverend said, the millennial bug, 1999, we believe that the Son of Man was going to come. I remember that there was a wave of rapture within the 1980s and the 1990s, where everybody believed that the rapture was going to come around that period, and there were a lot of videos around it. But the truth is that when Christ is going to come, Matthew chapter 24, I think verse 13 tells us that until the is preached to the end of the world, which is until the last 15 years about it, the rapture will take place. So let's try manipulate heaven and God's timetable for him. God's timetable is his timetable. And what we should focus on is the message of salvation. That's the duty of the church. It's possible to look at the theology behind the coming of Christ. Let us spend more time winning souls for Christ. If we spend that time winning souls for Christ, we won't be bothered so much as to what 5G means and how it interprets to the coming of the Antichrist. Like I said, from my point of view, there are a lot of Antichrists on social media already. There are a lot of Christians today that have turned Antichrist. And the work of the church now is salvation. So, to the caller who called and was talking about Pastor Chris, I have to say this to you. The problem is not the message of Pastor Chris. Pastor Chris is a man of a lot of people respect worldwide. But the responsibility is also for us to pick our Bibles and read and ask what the Bible says about the coming of Christ. You read your Bible and see 5G written anywhere either, would you? So why are we so fixated on 5G and we leave salvation?
Okay, thank you. Prof, do you have any comment on that?
Well, I think the discussion is fine thus far, and then what I would just advise each child of God to do is to live ready for the second coming of Christ. We don't need to bother ourselves too much about technologies that are evolving, and let me tell you, with the recent development in AI and ML, which I'm deeply involved in the next 2 years, you're going to see a lot of things. AI is going to permeate everywhere, and then so many things will happen so fast. So we don't need to entertain fear. But you see, we just need to live ready. A child of God should live as if the next 1 minute will be his last minute on earth. And when we live like that, when we live ready, all these conspiracies and things like that would not mean too much to us. We just know that if Christ should come, then I'm ready. Yes, and that's all. But what before, while we are still waiting for his coming,
okay,
I will enjoy technology.
Okay, sir. Okay,
I'll play my part, and I will also help develop what make life easier for everyone.
Let's take this caller briefly before we wrap up. Hello.
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 I'm with you.
Hello.
Hello, I'm there. Okay. Yeah. So I said we should just live ready. So when the time comes, and then the rapture occurs.
Maybe the network has. If the person can.
Okay.
Okay. Hello. Yeah. Hello. We can hear you.
Yeah.
Hello.
So,
yes.
So
go ahead.
Hello. Good afternoon.
Each child of God.
Hello. Good afternoon.
Yeah. Good afternoon.
Hello. I want to contribute.
Yeah. Go ahead. Go ahead. You are on.
Oh no. As a quick go.
Go ahead. You are on. Go ahead.
Hello.
Oh. Okay. Yes, maybe that's part of why you need 5G. Okay, let's try. If you can try to call back, then we can take your call. But let me take. I think Bishop, you were saying something. We just have about 5 minutes to close. You were saying something about Bill Gates. For the question from Mr. Lucky. And you were trying to, even though I think we've talked about it, but you wanted to drop a point.
Yeah, I mean, the point I was trying to make is that sometimes when technology comes, you look at it and it's scary, right? You fly in a plane from Lagos to 14 hours, 12 hours, you are plane, right? You are up in the sky. Do you know what the Christians, the first Christians that probably, I just imagine when the people fly in the sky. I'm sure some people would have said this is the preparation.
All right. Okay, so, sorry. Let me cut you short. Let me cut you short again and pick this caller, because I just want the caller to make his contribution. Yeah. Hello.
Yeah. Hello.
Yeah. Go ahead.
All right. Okay. I want to appreciate you all for this program. It has been very enlightening. Our brother from Canada, I think after this they should ordain him because he has been quoting a lot of scriptures. So, but my question goes to the bishop.
Okay.
Like it has been fully discussed here now that COVID-19 has no cure. And like he testified, which is good, that a lot of persons have been healed in his hospital, and just like we're hearing everywhere. Okay, so what are they using to treat the people? And why is it that Nigeria is not embracing the same and bringing Chinese doctors from outside? These are some of the things that raises a lot of crisis in the nation.
Okay, that's Pastor Miracle from Ekpoma. All right, Bishop, up to you, sir, before we close.
I will keep it. The use of hydroxychloroquine, they did a study, and they found out that people that were placed on hydroxychloroquine, by the 5th day, their viral shedding came to 75. By the put them with Zitromax, combined with 2, that by the 5th to 6th day, it comes down to 0. So there is no the virus shedding is 0. This study was done. It was done in the claim is that the study was very small. But chloroquine, hydroxychloroquine, used for other inflammatory conditions. They use them for arthritis, right? They use for, and it's not anti-infection. It's not an anti-infective part of the chloroquine. It's the anti-inflammatory part of it that is being used. So we have started using, and we're getting results. Now, I will also tell you, it doesn't mean people are not dying who have used. Not everybody who used hydroxychloroquine is going to get cured. All right, it's not. It doesn't kill the virus. All right, it basically prevents it from overwhelming your system. Right, so we have been using it. Hospitals area they've used it. I think that my own that's my opinion. It's like when the general in the Bible was told to go and the Jordan to cure his leprosy. What did he say? He said, ordinary Jordan. How can such a big problem be cured by such a small prescription? So that's why it's difficult for people to believe that this very powerful virus, ordinary something that was used anti-malaria, be now the one that people are propagating. So it's kind of, I would look at it that man always has a way of, when you give them a simple solution, we are direct. You know, you talk about salvation, you tell people, give your life, and it's very simple. You know, Jesus Christ is. Many times God has surprised men. You know, the wisdom of God, you know, is shared in ways that is foolishness unto man. So, and I think that even if you really look at it, God has made man to stumble hydroxychloroquine, and I would say it any day. Go ahead, if you are a doctor, start prescribing. The dosage, people talk about side effects. The dosage that we use for malaria, you know, I remember I used to use chloroquine as a. The dose we use for malaria is not anything compared to what we are using now. So it's a simple treatment. The dosage that's having the complications that people are afraid of, we don't get to that.
Okay.
If you use it at the dosage that is recommended, it's safe, it's recommended. Like I said, it's not everybody who is going to be cured by hydroxychloroquine and zithromax.
Okay, thank you very much. We are already very much out of time. But let me just ask a very simple question, and I just want a yes or no from our panelists. Do you think that the way Nigeria is handling the COVID-19 pandemic and outbreak, do you think it has been very good? Let me start from Reverend Chucx. You are in Lagos.
I just received a message on WhatsApp. Someone who's suggesting that the government is planning to use the lockdown for people to come out and celebrate Easter, and they are anxious to hear that the government has the lockdown. For me, until you see the curves, you know, the death rate, until you see it dropping, there is no point going out to socialize. I think we should forgo all forms of celebration now for two reasons. Number one, to keep ourselves safe. Number two, we should forgo all celebration to be in solidarity with the 1.5 million people who have been confirmed. And as we speak, apart from that 1.5 million people who have been confirmed, there have been 90,000 deaths so far. As we speak, it just became 90,000 while we're on this show. So we should forgo those kind of celebrations and whatever was not solidarity with people who have lost their lives. So we are not doing enough, especially when people think they have the assumption that it's government lockdown. It is not a rule, it is a state measure. And we should all imbibe.
Okay, to Mr. Olaolu.
Yeah, my answer is very simple. We're just reacting. It's as simple as that. We're reacting. And the reason I say we're reacting is because we see a government that celebrates isolation words, distribution of sanitizers, but grassroots sensitization is still zero. I posted a video on Facebook where a guy was touched quarantine or quarantine, whatever the English is now, is a type of cough. That's what he
God created man, his greatest asset, in his image and handed over the entire world to him. As the journey progresses, man finds himself in a challenging time as he battles with the coronavirus. The Diocese of Lagos Anglican Communion enjoins all Nigerians, especially Lagosians, to cooperate with the government and relevant agencies as we work together to defeat this epidemic. Stand strong, but staying at home is key to help stop the spread. If you feel unwell, call NCDC's 24/7 toll-free number. Do not panic, because there is no fear in faith.
It's actually coming down. Because the phase we are now is the phase community already. And then the figures we got yesterday from Lagos, well, by NCDC got me scared a little. Because I felt that the curve should be coming down, but I've seen cases of, and then that means we need to be more cautious.
Okay. Now,
I'm not sure they are able to trace all the contacts. And now that my brother talked about how AI helped China. Once they locate you, that you have contact with anyone with COVID-19, the camera, you know, the CCTV cameras around the town and things like that, identifies every contact you have. And after identifying all the contacts, they already have their database. And their data in the database, and then they go and then tell them to self-isolate or quarantine some.
Okay, thank you very much.
Okay.
Okay, sorry, thank you, because we are already out of time. But before we go, Bishop, sir, you've already commended the country, the Nigerian government, but there's something I also want you to clear, but just in 30 seconds. You know, just like we have been talking about conspiracy theory and propagandas, there's another thing going on now, that the Chinese medical teams that came into Nigeria has brought the what we have been talking about, has brought the chips and the virus and all those things, that so that people should run away or what. Do you think that the idea of bringing the Chinese medical team is a good one?
They are not needed.
Okay.
Nigeria has more than enough. We have enough medical personnel to cope. It's not rocket science. We didn't. I think if the Nigerian government got the advice of the doctors, we don't need more. We don't need anything. What Nigeria has done, I think, which is happening now, is that we have this virus has made the rich people in Nigeria suddenly realize you put health institution in our country, we will all die together. You see, before, when they have any small illness, they jump in their plane, go to US. But this virus allows them to run away.
Everybody is shut down.
So I'm hoping that after we have state-of-the-art medical centers in Lagos, in Abuja, and I'm also hoping that the churches too, you know, starting from our own denomination, that the Anglican Church, I'm hoping that all the dioceses will start thinking, instead of looking at how we can break our cathedral down, build a bigger one, we'll now be looking at how we can build health institutions. So that's what we are hoping to now, that we are going to now emphasize building health institutions in our country. But we have done, I think we've done very well. We've tried.
Thank you. Thank you.
Opinion was, I would have said, I would have voted for Chinese doctors.
Okay, thank you very much. It's been a long stretch, and I think the bishop knows that by now we should be at the washing of feet service. So that's what is coming up, which ought to have started by 4 on ACNNTV. So I so much appreciate everybody. Let me start from my prof. Prof, sir, don't worry. When the COVID is over, we'll come and celebrate. Thank you for taking time when I dragged you out to be here. Thank you very much, sir. And
thank you so much.
Bishop, thank you very much too. We are supposed to allow you to rest after a long night medical war. So please, thank you for your time too. Reverend Chucx, we appreciate your presence too. Well, he told me that someone bought some bags of rice in the street and shared it to all the household. So I've told him not to finish it. Okay, and Olaolu, we appreciate your time. I didn't allow you to sleep because I know by now it's just daybreak in Canada. So thank you for your time, and I think with this we've been able to do a little by giving our people some level of enlightenment on this. So we'll drop this and we'll continue next time, possibly on another angle to things, as we are going to be dealing more with the issue of end time and some other issues that come up. But I want you to know that you need to listen to the authorities, keep safe, stay indoor, and avoid unnecessary outings at this period. Stay blessed. God bless you.